This is a contrast CT scan of a 37 years old female. She is a known case of retroperitoneal leiomyosarcoma. She is on chemo. Her previous CT scan showed slight regression, which was done in February 2023. But this is the present CT scan which shows further progression of the disease. Now, starting from above downwards, this is the mass here. This is a huge mass. Anteriorly, it comes to lie against the anterior abdominal wall, more so on left side. Posteriorly, the mass has partly surrounded the abdominal aorta and the inferior vena cava here. Non-homogeneous nodular calcifications are present inside it. Areas of necrosis are also visible. In previous CT scan, there was no infiltration of right kidney and right kidney was normal. But in this present CT scan, there is moderate hydronephrosis on right side. Excretion of contrast medium is delayed. This is dilated renal pelvis here. Now, please observe that the mass has infiltrated lower part of the kidney. This is the region of the ascending colon. Ascending colon is displaced laterally. Its interface with the mass is indistinct. Now, if the retroperitoneal masses are small, it's easy to locate and comment that these are retroperitoneal masses. But at times, the masses may be so large, like this one, for example, although from its appearance, we know that this is an aggressive mass and the retroperitoneal masses may extend into the intraperitoneal compartments and vice versa. But at times, it is possible for us to make out the location, whether it is primarily a retroperitoneal or an intraperitoneal mass. Now, please observe its contact with the anterior surface of the aorta, partly surrounding it with the inferior vena cava, partly surrounding it, and involvement of the lower part of right kidney. Infiltration of. Now, these are known retroperitoneal structures like kidneys, blood vessels, pancreas, second and third parts of duodenum. So, any lesion which infiltrates, and of course, pancreas. So, any lesion which infiltrates these structures is primarily, most probably, of the retroperitoneal location. This is the coronal scan. Please observe infiltration of the lower pole of right kidney here and involvement of right ureter. This was not present in the previous CT scan. Please observe infiltration of the lower pole of right kidney. This is the delayed scan. It shows normal excretion of contrast medium on left side, while excretion of contrast medium on right side is delayed. So, whenever you find it difficult to comment whether it is an intraperitoneal mass or a retroperitoneal mass, one must always see the integrity of the retroperitoneal structures. Normally, the intraperitoneal masses, they do not behave this way. An intact interface or a fat plane is always visible between the aorta and inferior vena cava and the mass-lion, while in cases of retroperitoneal masses, these are obliterated. Although apparently it looks like that the mass is intraperitoneal and it lies in contact with the anterior abdominal wall, which of course is protuberant here on left side. This is the delayed scan, sagittal one. Please observe the infiltration of lower pole of the right kidney. This was not present in the previous scan.